Dear colleagues, I think that we can start the session. I know the break is amazing. It's a very beautiful networking part of the conference. However, it's also important to start and discuss about how to fight inequalities in cancer research and care. I would like to welcome all of you very warmly, and then my name is Iwona Ługowska. I'm going to share the session with Johanna Mattsson, and we will focus today. Our focus is to delve into the disparities that exist in cancer prevention, cancer diagnostic, cancer treatment, and also cancer research in our Europe. Then we will explore a strategy how we can combine the inequalities in an effective manner. So we also see the cancer disparities in Europe present in a significant public health challenges, and it requires coordinated efforts and policy reforms. So variation in cancer incidence, survival and mortality reflects inequalities in access to healthcare, quality of treatments, as well as research fundings across different regions and population. So our session will gather a leading expert to discuss and present approaches and policies designed to tackle with this issue. We will have privilege to have distinguished speakers who will share their insights and share their experience on various aspects of reducing cancer inequalities. And we will start with the implication of the Cancer Care Beacon project. We will go through the policies, real-world data, and we will finalize with this information about economics. So together we will explore those pathways, and I hope that after the end of the meeting we will be able to have at least a general ideas how to make the cancer care accessible to all. So we will start with the Cancer Beacon project, then we will go through the policy advocacy and healthcare reforms. We will then to discuss about innovative approaches to promote equity in cancer research fundings across European regions, and then we go to the real-world data for rare solid tumors as examples of disparities in cancer care. At the end, economic empowerment for patient-centric care and how to reduce financial barriers in cancer research. So each presentation will take around 20-25 minutes, and after those presentations, we will have the Q&A sessions. So thank you very much for joining this session, and I would like to hand over the floor to my co-chair to invite the first speaker. Thank you.
Thank you, Iwona. And our first speaker, Roberto Grasso, comes from the Department of Oncology and Hemato-Oncology of the University of Milan, and his topic is Cancer Care Beacon Project, Reducing Disparities Across the European Union.
Thank you very much for the presentation, for the invitation. I'm very happy to be here. I'm very happy to present the Beacon Project. Beacon Project is a U4Health project. It's a 2-year project. It's start in November 2022 and will end in October 2024. The Istituto Europeo di Oncologia is the coordinator of the Cancer Beacon project, and Professor Gabriella Pravettoni, which is the director of psycho-oncologists at IEO, is the project coordinator. Now we are going to present the aim of the Beacon project and what we are working on, what we are finalizing, but also I will pay a lot of attention on one part of the cancer disparities, which is not too much pay attention, which is psycho-oncologists, access to treatment screening in psycho-oncologists. Cancer Care Beacon, we start from the main tool that we have from the Europe Splitting Cancer Plan, which is one of the pillars aiming to tackle cancer disparities on screening program, prevention, treatment, diagnosis, but also quality of life, but also rehabilitation, physical rehabilitation, and mental rehabilitation. One of the main aim of the cancer disparities, which is one that we are really focused on the Beacon project, is access to information. So access information, not just related to cancer patients and their families, so where they can find their nearest oncological center, where they find some specific screening program or special treatment, but also information for healthcare provider and also information for researcher in the field of the cancer care. So we apply to this call which is aiming to mapping all the capacity and capabilities in the cancer center of the European Union at the national and also regional level, to try to underline which are the gaps in the cancer center and what are the different disparities especially from the eastern countries compared to the northern one. The background of this call is to, create synergy and networking also from the cancer center and to get access a lot of information, especially information for patient, but also for the other important stakeholder. So we focus on the OECI network, or the OECI Comprehensive Cancer Center. OECI is not one of the partners of the Beacon, but gave us a letter of support. The reason why we are focusing on OECI Comprehensive Cancer Center is because we want to map all the capacity and capabilities of those cancer centers that have a certain type of accreditation. So as you can see, there are a lot of OECI network, but not all of them are accredited, especially in some countries like Croatia, Slovenia, or Poland. So as I mentioned, the specific aims of the Beacon project are mapping the capacity and capabilities in the Comprehensive Cancer Center, OECI, but also to create a repository, an open repository that we call the Cancer Wiki. It's a kind of Wikipedia. I will talk about later about that. So we aggregate all the not data, but metadata. We are not mapping data. Not data of patient, but metadata, so public available information, information coming from public repository, public data sets, and sometimes published through the online cancer center. And finally, we are aiming to create a decision support system for the main stakeholders. The repository that we are creating is interacting with the decision support system. So all the information that we are collecting are interact with this decision support system that, as you can see, is aiming to help the four stakeholders or patient to find their nearest oncological center or where they can be treated, but also healthcare provider to find second opinion on other relevant information regarding kind of patient that are treated, and also for researcher to get access to data for sharing researcher in cancer care, but also and finally for healthcare provider for getting for allow funding for the patient needs. So this is our wiki. So as you can see, it's a wiki page. So everyone can go inside and edit. And there is all the nation that you can see. So you can click on side and find where there are the OECI Cancer Center within their nation. And you can find a lot of information related to screening program, type of treatment, proton therapy, radiotherapy, but also information regarding psycho-oncological support, and other type of information. So here is we are basically facing a issue with the PICOM project, because what we need is an interaction with the cancer center, with the UCI Cancer Center, because we map a lot of information, and we need to know if this type of information, these metadata, are useful or useless, or maybe we can improve. So, and there is the possibility to go inside and edit and give some feedback. We send hundreds of mails to the cancer center. We try also in all way to interact and get feedback to create networking, because I think this is the only way we can find good data. We perform also some qualitative study within the Beacon project, especially our group from IEO. We are psycho-oncology, that's the group of the University of Palermo. We perform focus group in Italy, but also in Croatia and also in Slovakia. And in this focus group come up a lot of interesting disparities from the patient perspective. So a lot of waiting lists, of course, bureaucracy, but also some geographical disparities between rural area and the main city, but also, for example, in Italy, from the south of Italy compared to the northern one, especially for rare cancer patient. But also there is a lot of financial burden, so travel costs, but also private hospitalization, psycho-oncological support. I will talk about that in a minute. Also training regarding the patient and the doctor respecting communication with the patient, and accessible information through internet. So, as you know, cancer is not affect just the body of the patient, but also is affect the mental health, and not just the mental health of the patient, but also the mental health of the whole system family. We say that cancer is a family pathology, because it's changing everything. It's changing timing, it's changing, the timing of the screening, of the treatment, of the chemotherapy, but also affect also the relationship between the family members. And the timing is becoming really faster in the cancer care journey, compare, for example, to other type of pathology, which are neurodegenerative disorders or Alzheimer's disease, which are really long compare. And cancer, we see from the literature that have a lot of mental health implication, and a lot of psychological and psychotical disruption, also emotional and anxiety and depression. But also, it seems that provide psycho-oncological support can reduce and help the quality of life of the patient. And also, obviously, there is a lot of disparity in access, in screening and treatment in the psycho-oncological support in the Eastern Europe compared to the Northern one. As you know, there was released recently the ESMO guideline for anxiety and depression. This is a paper from Professor Grossi of the University of Ferrara, which underlined the importance of the quick screening assessment on anxiety and depression, but also the use of multi-approach, like psychotherapy, of group therapy, of psychoeducational support to reduce the burden of cancer patient. This is quite important. In fact, we did a prospective study in our in our group in IEO, and we see that very interesting results. So, for example, only the 37% of the country allow money on psycho-oncological support. There is really a lack of knowledge of the impact that psycho-oncological problem affect the quality of life of the patient. There is also some socio-demographic factors. So, for example, older people or male or people with low education are not too much engaged to have psycho-oncological or psychosocial support. Also, cancer types is changing a lot. For example, breast cancer patients are more allowed to go to psychologists, psychotherapists compared to the prostate cancer patient. It's probably also related to some sexual aspect. And obviously, there is also disparity in geographical parts. So rural areas are not provide this kind of support, and there is a lack of certification and training. So who are the psycho-oncologists, which are the training that you have to do? In some countries are psychiatrists, in other are psychologists, in other are social support. So there is not guidelines on this, and there is not guidelines also in the practice. All the information that come up from our focus group, we put in the final product, so in the decision support system. So all the waiting list, so having also clear information regarding waiting list. This is something that it's not easy to get. So some metadata are not public from the cancer center. This is, I will say, also quite pity, you know, because if we can get access to all this data, everyone can benefit, especially patients, but also family member, caregiver, and healthcare provider. Also geographical and regional disparity, financial burden, and I already talked about that. The lack of psycho-oncology support, this is something that come up in all focus group that I did in several European projects. So the problem of mental health, the attacking of psycho-oncologists is something that come up very often in the qualitative interview. Also, the shared decision-making process inside the consultation between clinician and patient, so it's coming from the paternalistic approach to a shared decision-making process, and also the information needs and use of the internet that are lack. This is the decision support tool that I talked before. So the decision support tool is for the four main stakeholders. It will be an application. It will be able for patient for finding information for their cancer treatment, but also for the researcher, but also for the clinician, for get second opinion, and finally for policymaker. Regarding policymaker, I have to say that we had a lot of issue in finding availability from them, also for the focus group. We asked to also the project officer, to European Commission, to support us in, interact with them. Because I think also their perspective is important in all this process. As you can see, the decision support system is for all the four stakeholders, and you can look whatever you want, and you can find all relevant information. So, for example, you can find psycho-oncologists, where I can find psycho-oncologists in Europe, or maybe you can find where I can find proton therapy center within one country and another, and come up with the information that we mapped so far. Again, the decision support system interact with the wiki. So all the information that we are from there are essential to develop the tool. And I say it again because really we need the help of everyone to interact and to get access not only to the metadata, but also provide feedback if something we found is not clear, if the metadata that we found are not accurate, because this is really quite important. And so finally, we are as I told you, the project will end in October. So we are in the last month. We are developing the decision support system, and we are doing also a lot of usability testing, also user experience for our patient, but also for our clinician to develop all this product. And yes, this is the end, and thank you. I would like to thank you also the consortium of the Beacon project, which is Spordata, our technical partner, the European Alliance for Personalized Medicine, University of Palermo that help us also in all the psychological and qualitative interview, and the hospital of Zagreb also that will come up with the sustainability plan of the project. Thank you, and if you have some questions.
Thank you, Roberto. Very impressive work. My first question is related to the discussions with the policymakers. So what are your thoughts for the next steps to implement this also as a tool to collaborate with them?
So this is a very difficult question, because not just in the Beacon project, but also in another project, we had this, problem to find, not just to find them, but they don't give their availability, to interact, to create a focus group, to get this. This is a pity. And also with the European Commission, with our project officer, we try every time to engage them. So I don't have an answer for that, but we really need also their vision, their perspective to implement and to try to bring all the patient needs to a European level.
Thank you. So questions from the audience?
Yes, I think it's very important and good results you got. But what I really feel is extremely important is to look to social disparities, going deeper, because social disparities are very, very heavy in Europe. We, as ECPC, did a couple of years ago, we published also a paper on this, and also the European Commission doesn't know too much about this. But we know, for example, that for some countries there are no recognition during the chemotherapy treatment as transitory disability. Very, very little things are done for people that are sick and keeping their job. So it would be really very nice to look for this, because, as you know, the European Cancer Plan just puts social benefits as one of the most important part of the pathway of patients. So I would like to go inside this, and we have still a lot of publication on this, but it would be nice to go deeper through your methodology. Thank you.
Thank you, Professor. I completely agree. And also they come up with a new approach of comprehensive approach of mental health, and they are going deeply also to this kind of aspects.
Any more questions from audience? Roberto, I'm also very impressed with this question.
Oh, yes,
oh, yes
if I can, if I may. Yes, I understood that you started this project with the some countries of Europe. So is it a way to extend to the rest of Europe, or So sorry to ask the question, but yes, four countries is nice, but it's just a start. We need to go up to 2024, 26, 27.
Yeah, I totally agree. So this was like a kind, I will say, a piloting for regarding the OECI Cancer Center. For sure, we need to explore all the mapping. I will say not on the nation, but also to the regional level, because you know there are a lot of different, especially in Italy, there are all the healthcare is governance by the region, so there are a lot of lack and difference between southern region compared to the northern one. That's a first step for sure. It was not easy to get also this mapping, also because we go through each website, and some websites are really full of information, others are totally empty, I will say, but for sure we would like to go and move forward with the mapping.
Okay, thank you.
Yes, any more questions? So it's like for me. So I'm impressed with this project, and you defined many inequalities in different aspects. My question to you is about sustainability of this project. What would you like to do, not only with gathering information, but also do you have any strategy how to reach your partners, so at least address, so clinician, how to reach researchers, and of course patients with information that are already collected in your wiki?
Well, that's a great question, Ivona. So that's, I think, also why I'm here, because I think we need to move to a networking perspective, and you know, that's also these events are so important, you know, to exchange a lot of different vision, expertise, and not just for the clinical aspect, but also for the healthcare aspect or the other kind of important aspect that we need to take in mind. And I think that's in presence, maybe it's a better opportunity to exchange, you know, impression, and also to try to have synergy with also other projects. We are trying to do this with also some European U4Health project that was funded in the same call of ours.
Okay, so because we have a very clear title of our session, How to Fight Inequalities is Cancer Research and Care, would you give us a kind of recommendation how to fight the inequalities in psycho-oncological care?
Well, one of the things I think is to provide real data on psycho-oncological impact in also the cancer journey, but not just for the patient, because unfortunately it's worse for the caregiver. So researchers say that there is a lot of post-traumatic distress, the double of the caregiver compared to the patient. And that's for a lot of reasons, because they have to sustain their cares, and they cannot, you know, explain their situation. They have to change life suddenly. So they have to leave their work, they have to travel with the passion. So we need to, you know, to thinking more about that. And also there is also the health cost related. So for example, these costs are not covered by the government. And that's really pity. Most of the patients have to, you know, pay themselves to go to a psycho-oncologist. But also we need the guidelines. And that's why also the European Commission put a lot of effort in the mental health and cancer area. Thank you.
Thank you very, very much.